So lastly, I did say with the CIN is according to category 1 to 3, mainly about the extent and the severity of the neoplasm or the changes or the damages that are happening in your womb. So the pap smear, when you get your pap smear done, is going to tell us if you have persistent HPV infection. Is going to tell us if you have the grade or the damages or the changes in your womb are grade 1 or to grade 3. If it's grade 1, is many mild dysplasia or abnormal cells that are forming in your womb. Those changes, they hardly can progress to cancer. It's still mild. But if it's CN grade 2, remember we said this is cervical intraepithelial neoplasm, right? Graded according to 1 to 3. If it's CN grade 2, this is moderate dysplasia or the changes or the damages. So this is kind of like the severity is more than grade 1, obviously. The abnormal cell changes as well that can progress to cancer if not treated. If it's IN grade 3, this is much more severe dysplasia or the changes in your cervix, in your womb. So this is high grade abnormal cells, and these changes can definitely progress into cancer if not treated. So the CIN or the changes in your womb that are being monitored or that can be detected and that can be screened and looked for by this pap smear, they are graded into these 3. So this is when already people have those changes that are occurring in their system. We did say once you contract HPV, you don't have signs or symptoms till it makes you sick. That's why most women, we only pick them up once they are sick, because they only come to the healthcare system once they have symptoms. That means it's a bit late. Normally they don't have symptoms. When you are screening, you'll find people that have high risk HPV infection, but they don't even have symptoms. They don't show symptoms. Therefore, you'll be continuing closely monitoring them for the development of these dysplasias or these changes. When they happen to change, you need to manage them accordingly ASAP, not to progress into cancer. But once these CIN changes are severe and this person has now cancer, they graduated from just this dysplasia that we see into cancer. Cancer also has 4 stages, the stage 1 to 4. So with stage 1 cancer, it's when obviously it's confined into that cervix. It's still on that, it's according to location and severity, right? Stage 2, it would have spread just not above or to the boundaries of the pelvic wall and stuff. Then stage 3 is now it's spreading. It's even touching the pelvic wall. It can spread to the neighboring parts as well. Stage 4, it can go into even the neighboring organs. So it's according to the extent and the severity of how far it has gone. And the management obviously is dependent on how far it has gone. It's easier to manage it, and the chances of survival are much easier if it's early, it hasn't really spread. So that's why we need to continuously screen women for this HPV infection and especially for cervical cancer signs. So we have pap smear, we have HPV testing, we have regular screening and safer sex practices. All of these are more like preventative measures that you need to apply as a woman to know where you're standing. And if you have any HPV infection, you need to continue the close monitoring and screening to see if there's any progression of the infection that you've got. So if it's women that are HIV positive from 25 years of age, well, according to the guidelines in South Africa says women that are HIV positive from 25 years of age, they need to be screening every 3 to 5 years. So you are screening. If you don't have it, you continue to screen, especially, you are a sexual being, right? You're also growing and all of that. So that's the guidelines. If you're HIV negative, it's from 30 years of age upwards. But remember, sexually transmitted infections, you are at risk of contracting one for as long as you are sexually active. Today is not the 25-year-olds and the 30-year-olds that are sexually active. It's even teenagers, it's children that are younger than this age. So it's important for you to conduct or to take care of yourself, to hold yourself, try to abstain as much as you can. If you start being sexually active, make sure it's safe sex practices at all costs. It's for your own damn good. And there's HPV vaccines. We did say HPV vaccines are given to those young girls to try and protect them, because majority of the cases were HPV infection, they contracted it during their sexual debut, first time having sex. So from the very first time of sexual intercourse, you need to make sure it's safe sex practices. And then when you get to these older ages, you need to make sure that you are screening as much as you can according to the guidelines, to try and look for these things. So you are not healthy because you feel healthy. You are healthy because you've screened healthy. All the tests saying you are negative, you are on point, and then you try your best to maintain that negative status as much as you can. So it starts with the health check, baseline health check, especially when we are starting a new relationship, or when you are considering getting married to this person. Both of you have to undergo screening, health screening. You need to know who has what. You need to know the baseline of everything. We do have the screening and prevention. I did mention about that, and I just want to emphasize it because it's something that I do say cervical cancer is one cancer that we know exactly what causes it. It's one cancer we know exactly how to prevent it. So there's actually no reason for us to continue dying from it the way we do, or continue detecting it late the way we do right now. We need to be on point in terms of screening, looking for it, getting the test. Even the tests that are taking forever, taking a pap smear, you must wait for 3 months to get your results. It shouldn't be like that in this time and age, especially because we have all the tools that can help us get the results ASAP. You need to get the results. When a patient come to the healthcare system, ideally they need to be tested right there and there, and we get the results right there and there, and manage the patient accordingly right there and there. But I'm just emphasizing the issue of screening, early detection. If it's there, early detection, therefore early management, it saves a lot of time, it saves a lot of work actually. So yeah, everyone, make sure you are well informed about this, and you make sure that women in your circle, the little girls, have gotten their vaccine. Older women are going for their screening. Whether HIV negative or positive, women must be going for their screening. We must also have consistent conversations about safer sex practices. That's very important. It is everyone's business and it's everyone's benefit, because if I'm sick, all my circle, they get to suffer emotionally, spiritually, and otherwise, even financially. If I get to be sick and nyalala pants, I get to be bedridden and stuff, my whole family, my friends, my colleagues, everyone suffer. So it's not just me and my life alone. I can't be that selfish and thinking just for myself. And you cannot just be thinking about the pleasure, the 2 minutes pleasure, and not applying your mind. We are not in the time and ages of our parents where the knowledge was not there, the measures were not there, even science had not advanced at the time. Today, I need to see outbreak of very well-informed youth. And you don't have to be a health expert. You don't have to be in medicine, medical field to understand these things. It's basic health information that each and every one of us should be able to pass it on to our friends, should be talking about this in every platform where we gather together, whether it's males or females platforms. I would love to see with us talking more about health literacy, talking more about preventative. I am very big, those who knows me know, I'm very big on prevention than cure, because it's difficult and it's way more expensive to cure compared to the measures and the lifestyle modification and the money that it can be invested in prevention. So yeah, with this information, I hope we all aware of how important is prevention, and everyone will continue talking about prevention, sharing this information about prevention more than anything, and early detection, and know who is at risk, and all of that. We know that risk factors were diseases, especially now talking about infectious diseases, would be like your HIV, immunosuppression. We did say immune system is the one that fights off these infections if you have them. But if your immune system is compromised, whether you have chronic diseases, you have chronic treatment that you are taking, or your body is not able to fight off anything, so you are at risk of having these persistent infections, and therefore once it's cancerous, you are at risk of also getting severe disease and succumbing to the disease. So yeah, just be aware, make sure you share only accurate news, because everyone is an expert these days. Everyone talks too much, but make sure that you are actually spreading only the accurate news. Check your sources, check credibility, and yeah, let's all stay safe. And thank you so much. I will answer other questions again when I get time. Humble apologies for taking this long to respond to this question again. Thank you. Good day, everyone.